Today's topic is respiratory alkalosis. How can we differentiate between metabolic and respiratory acid-base disorder? If the pH and bicarbonate ion goes in the same direction, they decrease or increase in the same direction, then it is metabolic acid-base disorder. If pH and partial pressure of carbon dioxide goes in opposite direction, then it is respiratory acid-base disorder. Now we come to the main causes of respiratory alkalosis. First, increased alveolar ventilation, which causes maximum expulsion of carbon dioxide, means loss of CO2. Then decreased arterial partial pressure of carbon dioxide. Arterial causes partial pressure of arterial carbon dioxide causes decrease in hydrogen ion concentration and bicarbonate ion concentration by mass action. Then the other cause is decrease in oxygen in plasma. And the fifth cause is, the fifth one is meningitis and head injury, then anxiety. Now we come to the sign and symptom of respiratory alkalosis. Symptoms: the first one is dizziness, then bloating and numbness in hands and feet. Then the next one is discomfort in chest area, then confusion, and dry mouth, and tingling in the arms. These were the signs and symptoms appearing in the patient of respiratory alkalosis. Now we come to the compensation of respiratory alkalosis. compensation. First, renal compensation consists of renal compensation consists of decreased excretion of hydrogen ion and ammonium ion and decreased reabsorption of newly formed bicarbonate ion. Decreased reabsorption of newly formed bicarbonate ion. Then the next is the other compensatory point. In acute respiratory alkalosis, renal compensation has not yet occurred. Then the next one is in chronic respiratory alkalosis. In chronic respiratory alkalosis, renal compensation has occurred. That is decreased reabsorption of bicarbonate ion, that is decreased reabsorption of bicarbonate ion to maximize its excretion. Then the last one compensatory point is remove the cause of anxiety.